Hello, my name is Holly Moran, and I will be presenting on my final project, the You're Not Invincible campaign. You're Not Invincible is a diabetes screening promotion campaign that targets high-risk younger adults aged 20 to 44 years living in food deserts in Marion County, Indiana. Marion County encompasses the city of Indianapolis. High-risk younger adults refers to those who are at high risk for developing prediabetes or type 2 diabetes. According to the American Diabetes Association, these are asymptomatic adults who are overweight or obese and have one or more additional risk factors for diabetes. The goal of this campaign is to increase the diabetes screening prevalence for the target audience by 10% in a 12-month period. The benefit of getting screened at a younger age is to get diagnosed earlier in order to prevent long-term complications of diabetes, such as nerve damage and kidney disease. The campaign will be based on the health belief model and the social determinants of health as defined by Healthy People 2020. The specific social determinants of health that are considered are neighborhood and the built environment, and under this falls access to foods that support healthy eating patterns. So the question is, why target high-risk younger adults in Marion County, Indiana? First off, Indiana has the 9th highest rate of diabetes of all states in the U.S. The prevalence of diabetes in Marion County rapidly increased from 2000 to 2008, according to a report by the Marion County Department of Public Health. The prevalence continues to grow as it was 10% in 2008, and today it is 12%. Marion County is poorly ranked compared to other counties in Indiana. It is ranked 87th of the 92 counties regarding health factors, such as clinical care, socioeconomic factors, and the physical environment. As mentioned in the last slide, access to healthy foods is one of the key social determinants of health for this campaign. 17% of Marion County adults have inadequate access to food, and 9% are low income and do not live close to a grocery store. Neighborhoods that do not offer access to affordable, nutritious foods because of lacking full-service grocery stores are defined as food deserts. Often, food deserts are home to convenience stores, such as dollar stores and gas stations, which usually offer less healthy foods. Consumption of less healthy foods is linked to obesity, a major risk factor for diabetes. According to county health rankings, 33% of Marion County adults are obese. This is why the campaign is specifically targeting high-risk younger adults living in food deserts in Marion County, Indiana. This map shows neighborhoods in Indianapolis that are considered to be food deserts. As you can see, they are quite prevalent in the county. Prediabetes and type 2 diabetes were commonly known to affect adults later in life. However, according to several studies, the incidence and prevalence of these diseases are dramatically increasing in younger adults. A retrospective cohort study done in the UK revealed that standardized incidence ratios of newly diagnosed cases of type 2 diabetes at age 40 years or younger increased from 217 in 1996 to 2000 to 598 in 2006 to 2010. When a person develops diabetes at a younger age, they are at an increased risk for chronic complications associated with diabetes, such as nerve damage, kidney disease, and stroke, due to longer disease exposure. A cross-sectional study looking at diabetes screening prevalence revealed that compared to older adults, younger adults were more likely to have lower income, less likely to have a high school degree, and less likely to be insured. Like access to healthy foods, these are all social determinants of health. Socioeconomic deprivation has been found to be a risk factor for diabetes, especially among inner-city populations like that of Indianapolis. For younger adults, this association is believed to be due to consumption of energy-dense convenience foods and sedentary habits. As mentioned earlier, this campaign is based on the health belief model, which is a theoretical model based on fear appeals. Essentially, the messages of this campaign are meant to scare the audience into taking action. In the case of this campaign, the threat or condition is prediabetes or type 2 diabetes, and the recommended action is to get screened for these diseases. The health belief model assumes that the high-risk younger adults will get screened for diabetes if they regard themselves as susceptible to diabetes and if they believe diabetes would have potentially serious consequences. These fall under the risk appraisal, which is perceived susceptibility and perceived severity. Also, they must feel that the benefits of screening outweighs the barriers of screening. Self-efficacy means that they must believe in their personal ability to get screened. And cues to action stimulate one's decision to get screened. These cues to action will be shown as campaign ads and social media posts later in the presentation. The framework used for the planning of this campaign is the messaging model for health communication campaigns. Phase 1 involves establishing a campaign working group, which will include public health and health communication specialists from the Marion County Department of Public Health, diabetes medical specialists such as endocrinologists, and community stakeholders, including members of the target audience. Phase 2 involves doing formative research, specifically a pre-campaign survey and focus groups. This information would be used to help develop culturally consistent campaign messages. Phase 3 is the implementation and evaluation phase. This will include process evaluation to help improve campaign strategies and outcome evaluation in which the pre-campaign survey and post-campaign survey results will be compared. This will let the working group know if the campaign goal has been met. In other words, did the diabetes screening prevalence for the target audience increase by 10% over the 12-month implementation period? This is an example of a campaign billboard ad that would be placed in the target neighborhoods or food deserts. It says that diabetes is a leading cause of new cases of blindness among younger adults. This is a great example of a fair appeals message. It is meant to help the audience feel susceptible to diabetes and its complications such as blindness. One should get tested now so that they can learn early on how to keep their eyesight. The ad provides the link to the campaign's website, which is shown on the following slide. The homepage of the website talks about the campaign. There is also a facts page that is essentially meant to increase perceived susceptibility and severity. Finally, there is a resources page that tells the audience members how to get tested. If they do not have a doctor or insurance, then it gives a list of neighborhood clinics in Marion County where the service fees are based on income. This is meant to decrease perceived barriers and increase self-efficacy. These are screenshots of the campaign's Facebook page and an example of an Instagram post. Here are my references for this project. Thank you so much for watching.